جينا بال 2012 بعد الأحداث بسنة. لحظة مؤسفة وأليمة، يعني واحد تارك بيته وتارك أهله وتارك وطنه. تخيل إنه تارك بيتك وعفشك وكل شيء كونته ب50 سنة. ما حسنا نجيب معنا شيء بالمرة، صور، تحاليل، أشعة. ما في بيت إلا في مريض مزمن، يعني معه سكري، معه ضغط، معه قلب.
There's a lot of difficulties in treating acidities when you have no access to medical records. If somebody has diabetes or hypertension and he doesn't know what medications he previously took, this may lead to a lot of serious problems, and sometimes it will be life-threatening.
The American University of Beirut has come to the aid of the community for more than a century in supporting people in the medical, health, and educational fields, irrespective of who they are and where they come from. And I think Sijilli is an example of that.
The Sijilli project helps refugees through granting them direct, secure access to their medical records wherever they are in the world. The first challenge was how to transform the idea into reality. Sijilli, which means my record, could not have been if this was not a partnership. So GHI came with the passion, the idea came with the commitment to improve access to healthcare. EPIC mirrored that passion for the project.
EPIC is a software company for healthcare IT, and we have as the engine of what we do the electronic medical record. AUB was concerned that the refugees needed a record of their medical information. That's when they called us what the key thing was. How do we get the information to the refugee so that wherever the refugee goes, they will have that information to be able to give it to their new healthcare provider. Our system, EPIC, is too big. It would take too long to install. So a few of our staff said they'll write something smaller that could be put on a thumb drive and taken anywhere.
We started with a large group of engineers, almost 10 engineers. The execution of the project had several challenges. Different time zones, different languages, different user bases. We had to design a system to work even when there is no connection. It had to be really easy to use. We also needed to make sure that the data is accessible, but still maintain the privacy of the individual.
اجتنا لجنة من الجامعة الأمريكية وقعدوا وحطوا طاولات وكراسي وصاروا يسألوا هذا شو مرضك وهذا شو مرضك. وعطونا المفاتيح بكل لطف واحترام.
The data for the refugee is stored in a cloud. The USB, we did it for two purposes. If you end up in a place where there isn't any connectivity, also, we felt that there was some sort of an emotional connection to having something that was physical in their hands.
طبعاً الواحد بيرتاح لما بيكون معه المفتاح. أتمنى إنه سافر على شي دولة أحسن أتعالج فيها، أحسن أمن دواي فيها. يعني حتى لو ما نعرف نحكي لغة أجنبية، المفتاح هو بدل عن أمراضنا، يعني من دون ما نحكي أو من دون شيء.
Basically, once the patient comes to our clinic, all he has to do is to lend us the key. We access it through a certain username, and there's a lot of previous information about the diseases, the medication, the surgery, and the lifestyle. Sijilli not only save money and time, but also it may be saving lives.
I think the Sijilli project has shown that by bringing together different groups with different backgrounds, different expertise, is generally superior to each of us working alone. And certainly by reducing and narrowing health disparities, I think we can have a better world, a more inclusive world.
So we have now 10,000 refugees. Wherever they end up in the world, they now have access to their health records. Sijilli is not a project that is specific to this region. Sijilli is a global project with a proof of concept that happened here.
AUB is a wonderful organization. They're doing everything they can to help their patients. We're doing everything we can to help them. And the sense that we're saving lives and improving lives all over the world is very important.